the process was every nurse in this facility, whether you work for nursing service or for a non-nursing service, such as our medical service, our mental health, they all had to complete a self-assessment. So getting nurses to come here was not a problem. What the problem was is actually getting them here because of the unknown, the scaredness, just a COVID experience in itself.
The biggest fear was I would get sick. I think that was on a lot of people's mind because the CDC still had not, the guidelines were changing daily. And the biggest fear was I would get sick, we wouldn't have the proper equipment.
We didn't know for sure what we're getting into. So initially it was scary. It took a little while to settle in, but then I was pretty excited to go. There's going to be a change up of scenery, a new style of nursing, and it was just nice to go back to the bedside. I was really excited to get to use my nursing skills again.
We did have a couple days of training with the nurse manager, Ms. Krista Cruz, and with Ebony Lewis, the educator, and they did an awesome job just kind of making sure we were all competent in what we needed to do to take care of our patients on the COVID unit.
We was blessed to have the nurse educator we had because she took some nurses who haven't practiced med-surg nursing in greater than 20 years and made them very comfortable with what they were going to have to do. Help them to remember what they think they forgot. But they knew, but they just forgot they knew.
So the training that I provided was to help them bring back the memory. And to me, in my mind, it's muscle memory because these are things that we did in nursing school, or every one of the nurses have worked in inpatient setting before, whether it was critical care, whatever, emergency room, ICU, or the med-surg unit. They have some bedside experience, and so we had to pull that back out of them and let them know that, you know, you still have it in you.
I think having that emergency plan set, I think that puts a lot of people at ease, knowing that we can do it no matter what nurses you bring in, because you know the nurses here are ready to go.
I'm ready. I'd do it again. It was a really great experience. Like I said, it was fun to be doing bedside nursing again. It wasn't overwhelming. We had plenty of staff to help us out, and I would do it again. It was a good experience.
Our goal was to be able to give exceptional care to our veterans or anyone else who was coming through the door who needed it.
Do you think you achieved that goal?
I think we did, and I think our nurses were the ones who actually embraced their fears and took great care of the veterans that we did end up taking care of.